budget office can't take those into account. So you're not really getting a full picture of the savings. But needless to say, these headlines are terrible at a key moment in the health care debate.
Yeah, well, Savannah, why don't you stick around, because here with us now from Capitol Hill, we have Democratic representative from Maryland and House Majority Leader Congressman Steny Hoyer. Thanks very much, Congressman, for joining us this morning.
Good morning. Good to be with you.
Tagging right off of what Savannah was talking about and some of the criticism that CBO maybe hasn't looked at this bill closely enough, have you read the whole bill, and is it in jeopardy now given these headlines?
Well, let me say that I think that the headlines today and CBO's observations certainly are critically important for us to look at. One of the main objectives of this legislation is to bring health care costs down. Not only for individuals and families, which I think it will do, but also for government. The president has said that the present cost curve is not sustainable. We've got to bring it down. So I think we have to look very carefully at CBO's analysis and make such adjustments as are necessary to accomplish that objective. But the bottom line is both Senator McCain and Senator Obama both said health care reform was essential. Both proposed their plans, and we are proceeding to effect health care reform that the American public want. We need to have affordable, quality health care accessible to all Americans, and that's what our objective is.
All right. Mike Barnicle, jump in, and if, making adjustments to the bill, I guess, could be perceived as also watering it down.
Yeah, Congressman, if I went out this morning into the heart of Prince George's County, which is the heart of your congressional district, and I talked to the first 10 people I met, do you figure they would tell me that the thing most on their minds was health care reform or jobs, jobs, and jobs?
I think jobs, jobs, and jobs would be their major concern, even more so in other parts of the country. We're relatively stable vis-a-vis some other parts of the country. However, clearly the economy is on everybody's mind and is our principal objective. But as well, as you know, the president said in his campaign, handily elected, that health care reform was a major objective, and now I think is his principal priority. Overarching is the effort to get the economy moving again, get jobs being created, get people off the unemployment rolls, but also to make sure that all Americans have access to affordable, quality health care. We need to do both, and in the long run, clearly, that will positively affect our economy. However, we have to affect that reform in a way that does that and accomplishes that objective and bring costs down. I think that's going to be a paramount consideration as we go forward.
Savannah, jump in. Savannah Guthrie, go ahead.
Oh, sorry, Congressman, I have a question about how to pay for this. Obviously, that's a huge issue. The president had set up a proposal that would raise, I think, $300 billion or so by limiting how much wealthy taxpayers can deduct on charitable deductions. That's a proposal that got a very cool reception on the Hill. I wonder why that was rejected so quickly, and yet this notion about taxing health care benefits seems to have more resonance with many moderate Democrats and Republicans. Can you explain why one is more palatable than the other?
Well, pay-fors are always controversial, as you know. Buying things is easy, paying for them is tough. I happen to support both the proposal that the president sent down in terms of capping at 28% deductions, and I also think it is good tax policy and good health policy to limit deductions on employer health care benefits. That clearly is not supported either by the majority of Congress or by the majority of the American people.
All right,
the pay-fors that are being discussed, however, I think are viable pay-fors. They'll be debated. I think the Ways and Means Committee acted last night. I think that is one alternative that is acceptable.
Peggy Noonan.
Yeah, Congressman Hoyer.
Can I add this? Because while we mentioned the pay-fors, the president also suggested, and we are pursuing very substantial efforts to cut out waste, fraud, and abuse in the present system, and to affect efficiencies in Medicare and Medicaid. They're going to save over half $1 trillion.
Peggy? Yeah, let me ask Congressman Hoyer, Peggy Noonan here. Is there good morning. Is there any sense, Congressman, privately expressed among Democrats in the Congress, in the House and the Senate, that they would have actually quietly preferred it if the president decided in the past few months to focus solely on the economy, economic bills, economic issues, winning over the public on his economic stance, and not introducing a brand new scheme called health care. Is that ever privately expressed? Is there any sense of that up there?
Well, with all due respect, there's no brand new scheme here on health care. As you know, for 6 decades, presidents have been trying to effect health care reform to make sure that all Americans had access to health care. So this is not new. In fact, Peggy, as you know, as I said, both Senator McCain and Senator Obama throughout last year's campaign talked about the necessity for health care reform. So this is nothing new. The overarching objective we have is stabilizing the economy and bringing it back. We inherited the worst economy that we've seen in 75 years when President Obama took office. We're struggling to get that economy moving. We've taken decisive action. But part of that is also redeeming the campaign promise and using the momentum. As you know, presidents in their first few months want to use the momentum of the election to accomplish their campaign promise objectives. This is what the president's doing. That's what we're doing.
Okay, Congressman Hoyer, thank you very much. Savannah Guthrie, thank you as well.
Good to be with
coming
you.
up, I do want to show you this ad being put out by the House Republican Conference about the effects of the stimulus, or lack thereof. Maybe also playing into that public sense you were talking about earlier. Coming up next, the moderator of Meet the Press, David Gregory. We'll be right back with more Morning Joe.